So we're gonna go kind of like in order of my Jeopardy screen here. It might look a little bit different to everybody, but what we'll do is we're just gonna do a little gentle introduction. They're gonna let you guys know where they're based out of, what their specialty is, so you have an idea on if they do acupuncture, chiro, what that is. So that'll kind of help influence any questions that you have, and we'll go from there. So Miss Martina, if you want to kick us off.
Hiya, I'm Martina. I'm a vet, originally from Switzerland, based currently in Germany, but also working in the UK. So I'm traveling back and forth because I'm still their driving team vet. So I'm regularly going back to the UK. I'm a normal veterinarian since over 20 years. But I also have additional training in acupuncture, chiropractic, myofascial work. I even did some masters and courses and stuff like that. So myofascial work is quite important. I do a lot of manual therapy in my day-to-day work. Oh, and I have a big fetish for feet, because my husband is a farrier, and I found there is often an underlying issue when we see problems up top, or if we have problems up top, it changes how the feet are loaded. So there is a very intricate connection between feet and the upper body that's often overlooked. So yeah, nice to meet you all.
Oh, good. We're so happy that you're here. Miss Julie.
Hi there. I'm Julie Page. I've been a veterinarian for, 36 years now, long time. Based in Washington State, travel through Vegas is another secondary area of mine in northern Nevada. And primarily now for the last 22 years have been specializing in chiropractic manual manipulation, and recently, about the last 3 years, have started acupuncture and performance horse medicine, integrative Chinese herbal, all into that, and have really changed my vision of what veterinary medicine can be. So it's just really rocked my world, from the traditional sense of being that for so long. And when I couldn't fix my best friend's barrel horse from running up the wall, had it proven to me that acupuncture and chiropractic could change a life, and went that way. And it has been just spectacular since then. Plus knowing you, Celeste, it's, many years now too, seeing you grow and working in the bodywork and stuff too has been fabulous. Just, again, you can't unsee it once you see it.
You can't. No. Same thing. When I first understanding, I think you were the first chiro I ever worked with a horse, and I was like, oh my God, you can fix this like this? Like, this is incredible. And then, you start just dialing into the wheels, and yeah, you just can't unsee it. So that's so cool. Yeah. I'm so happy that you're here.
Thank you.
Miss Leona.
Austria, close to Vienna. I've been a veterinarian for about 15 years and an animal chiropractor. Then I added some soft tissue techniques to that, and nerve release and BTMM the last 3 years. 90% manual work and 10%.
Your mic's cutting in and out for some reason, but I heard you say 90% manual work and about 10% veterinarian medicine. Is that right? Mm-hmm. There we go. Yes. Now I got you. Okay.
Okay.
And you're also a breeder and a trainer.
Yeah.
Which I feel like is really important to note, because there's not a lot of veterinarians that I meet that are as well-rounded around like just general horsemanship as you. And I think that's just a really cool.
Yes, I grew up on a breeding farm, so my family has always had horses, and I grew up with horses and ride my own horses, show my own horses. But yeah, like horses all day.
Horses. So good. Miss Marthe.
Come on.
Yeah. Okay. I am a veterinarian in Alberta, Canada. I feel like the baby of the group. I've been practicing since 2019, and I do mainly GP, like equine workups, working with your typical problems, but I own some off-the-track thoroughbreds, and of course they are...
Please?
Pardon?
No, you're fine. People are just coming in. I think that was Heather, actually.
Okay. Yeah, anyways, those, they're just some big body issues that, like when you come out of vet school and you think that you can fix things following what they teach you in vet school, and you realize that lesions are still connected to an entire body. And so I did the nerve release course, and that has been pretty eye-opening and changed the way I look at horses. So yeah, that's who I am.
And you're awesome. We got to do a dissection where she came. And I know I speak for Lori too, and it was just like invaluable. Like the amount of, I just feel like you're just like a Rolodex of information. And that's part of, maybe it's because you're more fresher out of veterinarian school or what, but having you to just riff on so many things and so many topics so easily and so freely. And one of the things that I really love about you too is like the way that you also really like threw down for veterinarian medicine as well. And that's like a big thing that we want to talk about too, is like, it's not just body work, but it's also the importance of veterinarian medicine for people that don't maybe value that either. So I'm super happy that you're here. Miss Anne.
Okay, I am a veterinarian in Australia. I've been doing chiropractic for probably 15 years now, and I do acupuncture as well. And I have been riding since I was about 5 years of age, so do mostly dressage. So I just, like to improve how horses are moving and functioning so that we can have less issues later on down the track. So yeah, that's mostly what I do.
Super cool. I'll just kind of start with you and then we'll kind of go back around. What were you into body work before veterinary medicine or veterinary medicine first?
I did bodywork first, and I had my old horse now that used to flip himself over backwards when I did up the girth, and I had an amazing osteo that came and treated him, and it made a huge difference. So I was sort of interested in it from that point. And then I did vet because I didn't want to touch humans.
Fair.
So I did vet and then transferred across and did all of this as well after that.
Cool. Awesome.
Yeah.
And then, so that's cool. I think you're the only one that did that the other way around, which is really cool.
The other way around.
Yeah, that's really awesome. So you kind of maintained that because you were a vet when you worked with me already. So like we'd kind of like played.
Yes.
What was I guess like, so from going from doing body work then into veterinarian medicine and like now having both, what do you think like the averages for, are you doing like more injections, more veterinary medicine, or do you try to do more myofascial stuff? Do you do more postural training? Like what's your?
Probably more myofascial and postural training. Yeah.
Cool.
Yeah. I still use the acupuncture and so forth, but I don't do a whole lot of injecting these days.
Awesome. Is that just kind of resolving it through other techniques instead?
Yeah.
Yeah.
Yep.
Awesome.
Yep.
Super cool. And then Miss Marthe, so we're just going to go around backwards. With a veterinarian, like what made you want to do body work? Like what was that about?
Yeah, so that does stem from my personal horses. And so I think anybody who's owned an off the track thoroughbred knows they come with issues just from how they've been trained and worked. Yep. And my horse had kissing spines in 7 spots. He was explosive and dangerous. He like made me question a lot about my identity because he became really scary, and I wasn't like, I was feeling that like I was a vet and I was supposed to be able to fix my own horse. And so I mean, I have sometimes struggled to combine like the very rigorous scientific side of my brain with like the intuitive feeling in my body. But when I came across the balance through movement stuff, I started in a little bit slow, and all of a sudden I was like, nope, this is right. And I applied for I think I was in your first nerve release cohort. I applied for that Elements of Connection clinic and came and met you. And it was like just a strong, like, yes, feeling for me. And that did change to like, he is what he is, but he's calmer, he's safer, and he can do, within his ability. He's not going to be the dressage horse that I bought him to be, but yeah. So the bodywork stemmed from trying to help him and feeling like I was unable, he had all the injections. He had the bone scan. He had the ligament snip for kissing spines. He's had his cervical, like his APJs injected. Like he's had the veterinary workup, and there was something else that needed to happen. And that's how I came to bodywork. And I love it. It's like great to learn how to touch a horse so that they can relax and feel safe with you. As a vet, I think we're often poking at things that feel sore. The vet is, there with the owner who's usually anxious. The horse is anxious. It's nice to have that tool to kind of ground everybody. And that, it's been very sustaining for my career to add these tools in gradually.
What do you mean by sustaining?
Well, I think, vets get into the profession because they like animals, because they want to help people. And you end up feeling, you're always like, often they're in a bit of a crisis, like people are tense. The horse is tense, the horse is sore. Like I said, you're palpating, say they have a sore back, and you're going in and you're digging your fingers in those muscles, and the horse is flinching, and pretty soon they don't want to let you even near them because they're like, you're hurting me. And so to kind of soften your fingers and open your heart, and it's a bit of that energetic part of body work, but you can feel the owner relax. I've had owners ask if I've sedated their horse, just because they come in and you're able to be with them in a way that they feel calmer. And so what I mean by more sustaining is that feels good as an animal lover to feel like I am able to calm the situation down. And I think it also keeps me safer. So there's multiple ways that I mean that word sustaining, but it's like it's more satisfying. And
I love that. I think I told you about, we had a clinic with a really lovely vet and her off the track horse that was like quite explosive, and teaching her just kind of like neutral touch and playing with that a little bit, and then just watching her soften and watching him soften. And it, one of the things that it breaks my heart for vets is I feel like you're not taught really like good horse handling skills around that. And so you come in and, there's very much, and then, because you guys are called out to work on horses that are in pain, or God forbid an emergency or something, oftentimes then you have a 1,200 plus pound animal that is rather checked out of their body, that's defensive, that's dangerous, and it doesn't have to mean that the horse is a bad horse, but like horses are inherently dangerous. They're big, they're animals, they're flight animals. And then you throw them in pain. And then because of that lack of handling, I find that a lot of vets tend to be a little bit more heavier handed and abrasive because they're scared, and they should be scared. But that feeling of the kind of the going back and forth then like perpetuates the issue. And so to kind of like teach to soften them down and to kind of come in with a little bit more of that neutral touch and that loving energy, like for sure, I feel like would keep everybody safe. And I just, I just feel like you guys are set up for failure in a lot, for a lot of the schooling that you get, and it's heartbreaking to me. So I love getting to hear that like you find something that's like a little bit more, if anything else, just sustaining and to keep you safe, So.
Yeah, like a little anecdote. It was just a very simple exam. I went out to look at this little Arab stallion who needed some oral sedation prescribed to see the farrier. And he was hot and his owner was, she had some mobility issues, and he was like, I couldn't even really get around to like listen to his lungs and his heart because he was wanting to keep me at the front of his body. And I did a little pillar one with him, and I released his neck. And my tech, who's new to me, she was like, "What did you do to that horse?" Like both the owner and my tech were like, "You changed him. Like something changed." And like that is, I mean, besides the little like, yes, I am a horse whisperer.
Yeah.
But it's like then you can get in and do a good exam, and that horse is breathing and allowing you to touch him, and like, yeah. So versus going in with a twitch or like, or trying to put him up against a wall and then getting hurt because he knocked you over, or whatever you might have gone to if you didn't have that tool.
Yeah. And I have like, well, I mean, Sassy, like my mare, she hates vets, and I swear she can tell. It doesn't matter what vet that comes in, like she can tell if it's a vet or not, but it's because she has had vets go to the escalating pressure of like, and I mean, you know, she's not easy to work on either, but because there wasn't another way of handling, now she has a little bit of a thing around that because she assumes you're going to just come in and twitch her and stab her and not work with her. And so that kind of handling too, it just like sets up for the next vet that's going to get hurt potentially. And, you know, so
yeah,
I love that. Miss Leona. So were you a vet first and then a body worker and chiro?
I studied veterinarian medicine first. I graduated vet school and chiropractic school about the same time.
Oh, cool. Okay.
But I do remember exactly when, maybe, I don't know, after 5 years of studying, you finally come to the place where they do lameness exams. And I was really excited. And I remember, you know, watching the vets working on that horse and, you know, some diagnostic injections. And then, so the horse was like 70% better after injecting the hocks. And there was still 30% left. And this was this so-called like rest lameness, which the horse was sent home with. And that was so frustrating to me. I really remember that moment where I was like, so what about those 30%? You know, the horse never, I do hope, I think maybe things have changed since then, but I really remember like, what about those 30%? That's the 30% I'm really interested in. And what do we do about that? You know, so I really understand. I really remember that I was very curious about that and really frustrated about not knowing more what really was going on with that horse. And at about the same time, we had a chiropractor come to our barn regularly. And I was just very impressed with the work. It was a woman, one of the first women in our area that did, or first vets in our area that did that. And I knew from the beginning that's what I want to do. So next to vet school, I went to the animal chiropractic school and did that for a long time. And then I found another frustration for me because I felt like sometimes as a chiropractor, you feel like you're just, you're supposed to be a quick fix too. You know, it starts being the same thing as a vet that gets frustrating sometimes, you know. So like people in spring will be like, okay, we get like the dentist and the vaccination and the chiropractor and check. And we go on with everything else like we always did. So in that case, like the nerve release and then the BTMM really helped me to have more to offer to the owners of the horses, you know, to really try to make a change, a lasting change in their body, in their nervous system, in the way they handle the horses. And it's really nice for me to be able to offer all of this together because now I feel I truly do make a change in the horses. And like Martha said, you know, I think nearly every vet is in it because he loves horses or he loves animals. Yeah. And you end up in the spiral of working and being frustrated for whatever reason, or maybe being also in danger sometimes.
Yeah.
So it's nice to offer a different way. It really made a difference.
Yeah. I mean, I feel like, you know, you guys come out and you're supposed, I mean, not supposed to be like you are like industry leaders on like what you say goes. And so therefore you should have all the answers. And when you don't have all the answers, then it's like you're failing somehow. And it's heartbreaking. And, you know, I know like we were talking about, I'm sure Martina will go into it more, but like we're talking about, you know, training. And so, you know, going out and like doing all this work, but then they're going out and they're riding the horse behind the vertical the entire time. And you're like, oh, that's great. Like all of my hard work just went right down the drain and then you're called out to work on band-aids and somehow blamed for things that are outside of your control. So
Yes.
yeah, being able to speak to that, I think is huge.
Mhm.
Miss Julie, so talk to me about this horse that was climbing walls that got you to change everything. I love this whole story.
Well, and
That
again,
for a while before you did that.
absolutely.
Yeah.
I was, again, a practicing veterinarian for, almost 20 plus years. And I would say I'm not your typical female. I am a 6'4", very large female. And I used to.
You're a beautiful giantess, is how Heather and I we're just like, you're just incredible.
But I always used my size. I did. I mean, as a veterinarian, knowing no other way, we, again, as you're alluding to, we're not taught to be, smooth and, your vaccinations, things like that, but to approach, animals just more or less to get it done. You were there to get something done and learn a different way. But I think, again, integrating other modalities, again, like the chiropractic, you cannot get around an animal to make an adjustment if they're tense. Yeah. So I have literally learned to lower my heart rate before I even approach them. Before I get out of my vehicle to move into a barn, I clear myself. And it is amazing on how much that will, the animals will approach you when, you have no intent. And I'd say literally, I am here to help you through my mind and my body actions versus I'm here to, possibly inflict pain or, as a, veterinarian for a long, long time. And now I tell people that young, vets that are at a clinic here, I work in Vegas, to say, clear yourself. You need to. I know you have emergencies back there. I know you're late for appointments, but literally, clear yourself because it will make your life and your career much, much easier as you go through life. No matter, if you're going down the other roads of chiropractic, acupuncture, anything, but just literally clear yourself because as a fight or flight animal, they will fight and they will flight. And, you want them to be there, and happy to be there, with you do this.
Yeah. What changed you after all of the years of veterinary medicine? What made you want to do chiro?
That one of my, again, best friend's barrel horses wouldn't turn the first barrel. She just literally one race just stopped turning the first barrel, would just run up the wall to the left. And I did everything I knew as a performance vet, every injection, it had to been hocks, it had to been, stifles, it had to be, this, that, and the other, and couldn't stop it. And as, again, people come into your life, I had gotten a card in the mail from a veterinary chiropractor acupuncturist about 2 hours south of me in Washington State. And I said, Holly, load up, let's go. We have nothing to lose.
Yeah.
And took, this barrel horse down there and unloaded her. And as barrel horses sometimes are, it was, just snorty and up. And Dr. Moronic, she is a veterinarian that has done, again, she has the book on, where does my horse hurt and stuff. And she was my mentor and put a needle between this horse's eyes and sedated her. Like I gave her 5 cc's of Rompin. And you could see that that quickly. And you can see her whole neck was out and she kadink and, did some acupuncture, sent her home, and that mare never had the problem again. And I went, wow, this works. And so I brought her up to my practice for about 2 years while my child was young and just seeing the difference, had clients pull into her and every time I had her come up and she said, you need to go, you believe. And again, changed my life that way.
That's so cool. I mean, and I've watched you work magic for years. And I mean, Ace, that big guy, I definitely, the big break, I think, was getting to see you. And And it's just so cool. I mean, and like it is like you just, once you see it, you're just sitting there watching it and you're like, what is, I mean, I do all kinds of cool body work and I think that's neat. And then I watched you with your needles and your like magneto fingers when you're doing chiropractic. And I'm like, what are you doing? It's so cool. It's just, yeah. And it's just watching the whole system just fully let down and relax and just allow all of that energy to flow through. And yeah, it's gorgeous.
It is amazing. Yes. Yeah.
Miss Martina, so were you a vet first or body worker? How did this happen?
A little bit. I did first a complementary medicine degree while I was still studying veterinary medicine. So this is kind of like some manual therapy and some homeopathy and all those kind of herbal therapy, Western herbal therapy, because I grew up with that. My mom's what we would call a witch, so it's a little bit family.
Yeah.
But I had a horse. When you're young, when you're a teenager, there's not a lot of money, so you get one for the meat price because it has some issues, and then you have to deal with it. And he turned out to be my mentor. Vet came and did some chiropractic on it, and since I was studying veterinary medicine, because he could help her, and I was like, oh my God, I want to do that. I want to do that. So that was the first course I signed up after I finished my vet degree, was chiropractic training.
Nice.
And so I'm doing that now for 20 years. And it changed my world. And then you get cases where you think, oh, chiropractic is not enough. So it's really frustrating. So you learn acupuncture, and then you do your TCVM, and then you do the Trina because you want to be able to have the owners to do homeworks at home. And then you do some rehab courses, and then you feel that's not enough. So you do your myofascial courses, and it's the moment you have an open mind, or you always get those horses you need to learn what's best and what push you forward. And that's also why I'm so interested in feet, because it's, if you do chiropractic, if you do acupuncture, you get those horses right and you come back and 2 weeks later, they're again at the same. And even the saddle is okay. The teeth are good. They try to ride those horses okay, and they're still falling back. And I'm like, why? So I started to look more into feet. And what is foot balance? What can you see with posture from the outside? What can the owner see from the outside without really doing x-rays? And in the last 10, 15 years, that has come a huge way. 10 years ago when I was at big fair and vet convention, and there were a lot of x-rays with horses with MPIs in the hinds, and they were talking about how to shoot them best and everything. And at the end of the discussion, I asked the question, do you see in those horses with that kind of confirmation on the x-rays, do you see problems higher up? Because I see sore hocks and I see stifle issues and back pain. And they were telling me that I'm a dreamer with a big imagination. And now there are so many research papers out there who actually prove that when foot balance is poor, we get pathology higher up in the body, especially in the hind end where we have a true bony connection, whereas in the front, it's more contraction here because it's a soft tissue connection. So it's more dampening, but then you get the impact on your lower cervicals is higher when your foot balance is not right. And they often get then diagnosed with back pain or with tight thoracic sling. And that's just secondary. And for me, it's really important, which is the original problem, because if you can work as a vet on the underlying issue, then you can unravel all the things up top. And it doesn't matter if it's the feet or if it's like true hock arthritis. My problem is often, why do they get hock arthritis? It's often secondary to something else. Same as kissing spine. Kissing spine to me is a secondary issue. 95% of the horses with kissing spine, it's secondary. It's only 5% who have a genetic predisposition for kissing spine. Everything else is secondary. So we need to find the underlying issue. Is it ulcers? Is it sore feet? We had a stallion who had horrible foot imbalances, and he had chronic ulcers and chronic gut issues. They even wanted to put him down because he was short for breaking through. All we did was to change his feet, do manual work, so he was able to have the stomach again where it's supposed to be. Because like if they're contracted due to poor posture, for whatever the reason for the posture, your stomach will rotate, and then your plica marginalis, where that should be above the stomach acid, is constantly touching it, and you get constant ulcer, constant, because of it's not correct in the body. But when you get that tension away, it can actually heal. Otherwise, you constantly have to set them under ulcer guards or other kinds of omeprazoles. What happens? You get the secondary issues. Their pancreas is not working correctly. Their digestion is not working correctly. So you get a rat tail of everything behind. And, you know, like, I'm not against injection. If something's painful and chronically inflamed, you need to work on all your, construction sites. But often, my old boss was really good. He used the analogy. It's often not the perpetrator that screams, but the victim of a crime. So we see the victim is where we have the problem. That's where we have the acute inflammation. But we need to find out why is the acute inflammation there. If it's not from a direct trauma, we need to look for the underlying issue. And I think that's often still underlooked in normal veterinary medicine. We're great at first aid or band-aid medicine, but we're often lack in looking into why is it causing it. And like, do
you think that that's because of the curriculum and like how you guys are taught, like what they focus on in vet school?
That's one thing. And the other thing, for example, feet, you have maximum 8 hours on foot pathology. And that's covered with laminitis, pedal bone fractures, abscess, and navicular. That's it. And the normal anatomy. So how do you want to have like covering all the other things that can happen? Right. You don't even properly get taught what are all the ligaments inside the hoof capsule that connect to the ungular cartilage, like things like that. I see that so often, and it's like it's a time issue. If you work for a corporate, what's here in Europe very, very common,
we're having that issue here now.
You have 15 minutes per horse visit. You have 15 to 20 minutes max, and you have to have the problem solved. You have 30 minutes for a lameness diagnostic. That's like nearly impossible to do that.
Can we take a quick, this was not on the questions. No. Don't be sorry. Also, I know that my girl Heather's on here and Julie, like the amount of times that we're like, it's the fucking feet. It's the feet. Can we talk about the feet? And like, yeah, it's just really, it's nice to hear. You're fine. One thing that's not on any of the questions, and it wasn't even on a thing that we talked about, but it is something that I have heard from now you, Dr. Page, and Martha for sure. And I don't know about you, Anna or Leona, like if that's going on in your countries, but we're having like what I would consider at this point almost an epidemic of private practice vets closing down and not being able to afford it anymore, and then corporate taking over. And that's turning into a shit show. This is my meeting. I can swear it's turning into a shit show. Dr. Page, do you want to talk about that a little bit, like from here in the States, like what you see with that and what that looks like? And because I think that the clients that are listening to this need to kind of understand. I don't think anybody understands quite what's happening and why things are changing so much, but we're losing vets and we're losing them fast.
Absolutely. And just like Martina said, here in the States with the corporate takeover, I've always said, again, being out the longest, we weren't taught how to get out of veterinary medicine, how to leave practice. And corporate, unfortunately, has given a lot of younger vets a way out. But the way, or to sell their practice and get out, even as an older practitioner, but it just leaves so much to be desired. And the corporate way of practicing medicine is the same as humans. Yes, you have 15 minutes to make an exam, talk to an owner, try to make a diagnosis. And what I see is that, these young practitioners come in not really skilled yet and miss a lot of stuff or guesstimates. And then, they try something and then they're not even allowed to treat it because their time is up. And then it's another 3 weeks till they get an appointment to even treat an animal. And I see that so much here. now with so much corporate takeover. And small animal, it's been a long time coming, but it's rapidly increasing with corporate takeover in veterinary medicine and equine also.
And isn't there a big, please correct me if I'm wrong, isn't there a thing with the corporate medics where they're getting like bulk discounts on medication too? So they're able to charge differently than a private practice? Because I feel like that financially is a big reason why we're having.
Oh, absolutely. And again, most of these guys are, even in with some of the medical groups and get discounts, with that the corporate has taken into the pharmacies and things like that. So yeah, we cannot compete. I myself do not carry any medications. I would rather, have my clients be able to, go to a pharmacy and request a script rather than carry meds, because I cannot compete with the Chewies of the world, the Valley Vets of the world. But I know a lot of, again, veterinarian, even corporate clinics are so overpriced, and, people complain about that too, is that they, upcharge on that too when they see the price on Chewy or Valley Vet, and, knowing that, thinking that they have to get, medication to their veterinarian there at the clinic. And it's like, no, you can request a script for them too. But yes, very much so, that the price of everything has just escalated that I just gasp anymore to know what my charges used to be, and just could not imagine.
Yeah. And then I think this probably goes in with like the 15-minute, like the super fast cycle, but this is happening a lot in California. I've got a lot of clients that are dealing with this, and they're losing vets too, not only for the burnout of like, you're not able to like really make a difference because of the amount of time that you're given, and then the pricing structure as well, and like how it's really aimed for like just hard and fast medication. But then also they're just like the amount of appointments some of these vets are having to do to hold up every week. It's like, this is insanity, and the pay is not good. Like, they're not paying the vets crap, honestly. So you've got all of the student debt. You can really only go and work for corporate. You're getting, just absolutely, it's insane. I've never heard, and this is like in the last year or two that I keep hearing more and more about this. And I don't,
well, nobody's
talking
there's no
about
way.
it. My clients should know like what the vets are dealing with right now.
Yes, there's no way as a private practitioner I could compete with the wage base of corporate. They're coming out now, offering them, 6 figures, and there is just no way that any of us in the private practice, could come up with that. But the burnout, again, I see it here with corporates in other states I work with, and the burnout is much higher than I think it ever was in, a private practice, because I think we recognize it. They don't have hands-on with a lot of their practitioners, and, we recognize it if we're working with them every day, versus corporate that is just, watching the numbers come in.
Right. Exactly.
And in the UK and also in Germany, about 80% of our practices, 70 to 80%, are corporate now. So it's and it's often hidden, because like, even if you go, they don't tell you it's a corporate practice. They often, especially if they take over the bigger clinics, they keep the name because the clinic had a good name, and then it's just somewhere in a small print. It tells you, oh, it's now part of this group or part of that group. So it can be difficult for the clients to see. And in the first year and in the second year, you might not see a change. And in the third and the fourth, and especially in the fifth year, you then see how the whole dynamics are changing because of restrictions. You're not allowed to use this medication, or you have to order from there, or you have to use that lab because it's cheaper, or it's part of that corporate group. It puts a lot of pressure on the vets, and that time pressure and that restriction, what you're allowed to use, is also then making it difficult for you, like, to do a full evaluation. Because I know if I see a new client with problems, if it's a horse, I take between 1 and 2 hours for that horse. I can't do it shorter. It's impossible. If I want to do my gait analysis before and after, if I want to do a treatment, if I want to evaluate it correctly and look at problems and palpate and treat and then educate the owner on the homeworks that need to be done, or or show her what she needs to feel for and all that. That can't be done in 30 minutes. It's impossible. It's just impossible. And that's not that the vets are doing a bad job, but that's what I'm
trying to highlight. I'm like, it's like,
no, they just can't. They need to do quick fixes. And usually an injection for a sore hock is much quicker than to look at the horse and then to say, okay, what's causing the hock to overload? Is it the surface the horse is working on? Often you have them in the clinic, you don't even see what bloody surface they're worked on. Is it the intensity they're worked on? Is it the poor saddle fit? Because they often don't have that with them. So I request all those things, but to look at those takes time. And if you're working under time restriction, or if you're I have a friend who is the only large animal vet for a vast majority, like somewhere in Illinois. There's no others. So she's literally running from one emergency to the other and doesn't have the time to do all those things. It's not that she wouldn't know it. She just doesn't have the time.
Yes. And that's so like local to like where, not so much like where I am, but like Northern California area, like one of the big things that's happening. And this is, I'm hearing it all over the country, but like we're losing, like vets are no longer offering emergency services, which is horrifying because like that's, on my end, like the majority of what I need my vets for is I'm just like, when that happens. And so no longer doing, nights, no longer doing weekends, no longer doing emergency calls. And it is frankly because the sections of time that they used to have available, those time blocks that were available for, because they had just normal hours to be able to do emergency, those are now taken over with other things. So now they don't even have time for the emergency cases. And it's like, I've got my girlfriend that has a breeding farm, and that's just like, what am I supposed to do when, my mare has an issue or the foaling, and it's just, it is heart-wrenching. And so, I get the privilege of really being a bridge of like, I'm kind of between the worlds, and I work with so many vets that I love and respect, just like you guys, that I hear the discourse from the clients about what's going on and how shitty it is. And I'm like, I hear you. And also I just think that it's good for people to know that this is what you guys are dealing with. And then Marthe, you're dealing with this in Canada too, right?
Yes. Yeah. Maybe to a slightly lesser extent, although, yeah, there's 5 major equine referral practices in my province, and I think 2 of them have been bought by corporate in the last 3 years. So it is happening. It's more common in small animal than in equine. But I was having a few thoughts in terms of like my generation or like I know that there's on social media, there seems to be like this feeling that young vets don't want to do on call, or that they charge too much, or that they expect too much work-life balance. And I actually think that because of the pressure to bill, and because practice owners, whether they're corporate or private, they do need to make their bills, right? And I think that vets get more enjoyment out of focusing on the health of the horse. And when we're always focusing on the disease of the horse, like the decision fatigue, the job satisfaction, like, again, the stress of the clients, because it's like an emergency, like it does wear you out. And if you don't have those client relationships to kind of sustain you and feed you and like make you care about the individual, because they're your patients and you're their doctor, if you don't have that feeling in yourself, then it is really easy to burn out. And why would you care about, someone who calls you after their horse has been colicking for 3 days on, it's like a Sunday at 10 p.m. And it's like, I have to get up and work the next day, and I don't want to drive in a snowstorm. And this could have been dealt with on Friday at 3 p.m. when this started. But we don't even have a relationship. Like, I'm going to get there and I don't know if you're going to pay me. I don't know if I'm going to be working in the back of a sea can. I don't know if your horse's halter broke, or like there's like the relationship is what makes veterinary medicine good. And it's funny because we all say we got into vets because we don't want to work with people, but it is about the relationship with the people
It's true.
that makes it sustainable. And if the way the economy or the way corporate or how, if you can't form those relationships, then I think that there is a piece of that like you burn out. You do burn out because there's nothing feeding it anymore.
And I would argue, you know, circling back around to the halter break thing. And I know like we talk about this a lot. Yeah, I know we talk about this a lot, like with the nerve release group is, you know, the first thing, like before we even get into talking about like the body work moves or the postural stuff with BTMM, like we talk about neutral touch and signals to the gear. Like, does your horse feel safe? Like, is your horse okay being touched? And does your horse understand basic signals to the halter, which is going to play into chiropractic medicine, because you need to have the horse be able to like soften and like be able to play so you can get in and do your adjustments. And I always think it's so funny, like in the beginning of the cohorts, people are like, yeah, like, of course, you know, like, I don't even know why we're discovering this. And then you go out and you have to do your case studies, or you go out and you're dealing with the clients and you go onto these horses and you're like, oh my God, they're not halter broke, or they're not okay being touched. And I'm just like, the epidemic that is not good horsemanship lately is, I don't know what it is. And I'll just say, you know, I clinic all over the world. I would love so much to like teach on advanced stuff, and like I want to show off the pillars, and I want to do all these really cool things. And the vast majority of what I run into is helping the horses feel safe to be touched and teaching them basic groundwork. And I don't know, and we're talking like very, very upper level horses. And so if I'm dealing with this as a trainer, every single time I have to interact with these horses, I think about the vets that have to handle these horses. And I'm like, holy shit. Like, you guys are having to, and this is me on a good day, like much less so this is a horse like on a good day, doesn't have good handling skills, doesn't know how to stand, doesn't accept touch, doesn't accept like the following feel. And then when you guys get called out on that same horse on a bad day, what that looks like for you. And I don't, you know, and I talk about this for farriers too, but it's not the vet's job to train the horses. It's not the farrier's job to train the horses. And I don't know, you know, when you're out there for an emergency situation, you're not able to just not help the horse. You're going to help the horse. But I wonder sometimes if it's like a routine thing, if, you know, if you guys go out there, I mean, like, I'm pretty cutthroat when I go out for sessions. Like, if they want a whole body work, I will not work on a horse that's not receptive to touch. Like, there are certain things around like you know, I don't like necessarily using the consent word, but like if a horse isn't receptive to touch, I'm not going to like mash on them. I just don't think that that's okay. But I'll work with them in hand, and I'll get them more comfortable, or I'll get them more safe with the person. And then I will give the human that homework, and I will say, this is your homework, and I will come back in 2 weeks, or my practitioner will come out in a week or 2 weeks. And this basic thing needs to be done so that A, the horse can get the treatment that they want, and B, my practitioner or myself doesn't get hurt. Like, I have the luxury of being a horse trainer, and I have the luxury of like dealing with really violent horses. So like, you know, I can get in there and handle stuff, but a lot of you guys shouldn't be doing that. And I think that so many clients look at these behavioral issues and they're like, this is a pain thing, here, vet, deal with it. And like, it doesn't. Catherine's on here, you know, like, her and I have had catastrophic things with our horses, and it doesn't matter how much pain they're in. Our horses are still kind to the humans that are trying to help them. And that is, I think, the owner's issue. And I'm going to kind of get off of my soapbox here in a minute, but that's the other thing that I feel really protective around vets with, that is that I just don't think that it's fair that you guys have to deal with that. And people should start dealing with it. So I don't know if that's like, is that a conversation that you guys have with your clients when you go out there and you're just like, hey, so this isn't my job, you should work on this, and then I'll come back, but I'm still going to charge you for the fact that I had to come out here anyway. Like, is that something that you guys can do, you think?
Yeah, I mean, I feel absolutely guilty about charging someone if I didn't do the thing. But I've been called out for a lameness exam, and the horse is literally in 40 acres. And they're like, yeah, we haven't been able to catch him in 6 months. And I'm like, or a pre-purchase exam on a horse that is not halter broken. They want flexion tests. And it's like, and again, you're out in a field, like the horse just takes off. It's like, what are you going to do? Let go of the rope and bye. And for that, like, I think that finding your team is important, because if you can't solve the problem, as a vet, we're like problem solvers. We want to fix. what's wrong. I think that's like ingrained in a lot of us. And so, yeah, I'm not going to train that horse how to be halter broken in our, half-hour consult or whatever. But if I have someone who I can say, hey, call this person, that makes me feel better. Like at least I did.
Yeah.
I gave them something to follow up on. Yeah. Yeah. And I don't blame owners. Like I think that a lot of owners just don't have the resources that they need. So
Right.
So you need to, it's like you want to say it in a way that they understand that you're not blaming them, that they don't need to feel guilty for it. They don't need to apologize for it, but they do need to do something about it.
And you're working with, like, I'll give Maeve a shout out. Like, she's kind of putting together that holistic horse collective. And so it's like, there are people I feel like that are putting out a lot of like free content around, like, here's basic things that if you haven't been taught, you should probably learn. And then that's going to help your vets support all of that as well. Because, like you said, like, it's the relationships, like on top of all of the other things that you guys struggle with, if we're as clients, if we're also not being supportive and helping to make your job, I don't want to say like easier, but like to give it to, like, you're only coming out here to do your job. You're not coming out here and having to fight all these other things that maybe, I just think that will help, especially if all you have available to you is a corporate vet that only has 15 minutes. Like, you want to try to prep so you can get as much as you like actually can out of that session. And so I just, again, I don't think people really know that that's going on. All right.
Yeah. Well, and to Martina's point, like, especially if you're seeing horses in a clinic setting where people are trailering into you, you don't get to see, like, it's easy to assume that they know how to feed their horse, that they know how to house their horse, like that they're not standing in mud up to their hocks for like months at a time, that they say they get the teeth done, but like by who? And their farrier, won't talk to you, but you can see that the toe is way too long, and like there's all these little pieces that you can easily miss, assuming that people understand them, but it's not easy to understand. And I think that the quality of professionals is variable. So that makes it tricky too, right? Because they feel like they're checking the boxes. They've talked to their farrier or their dentist or, and they think that they've done that, but they haven't.
Mm-hmm.
Yeah.
Or like you said, the quality of professional might be different too. Like in regular veterinarian medicine, you guys only get like a little bit for dentistry, and then it's kind of up to you to go on to learn more things, and it's up to you to go on and learn other things. And I have had a horse that Julie's worked on that I've been just like, yeah, the owner said that the teeth are up to date, and she was like, I don't think this horse has ever had his teeth done. And I'm like, I believe you, I would agree. I can't say that though, I'm not a vet, but to get to have that, and it is, and again, then going back to the client and feeling heartbroken for them because they've got vets that are kind of like chasing this one thing and then maybe missing these other pieces. And then other people come in that might know the pieces that aren't, like for me, I mean, like I'm just like a lifelong horseman. So there's certain things that I pick up on that I just know just from being a horseman. And that ends up being really hard, which kind of, I think, is a good flow into, we've got a lot of questions. So like in the second hour, I'm just going to kind of rapid fire and we'll go through just like the different questions and what we'll play with. But I think that I'm going to preface this by saying, I don't think that there is a right or wrong answer to this. And I don't think that we're going to solve the problem in a webinar, but how would we, and I'll like throw back to Anne, knowing all of the different things from like bodywork and veterinary medicine and feet and, all of the different things, like for the clients that are struggling, maybe like the majority of, I would say, like the questions that came in were, how do we broach this topic of maybe it's body work or maybe it's feet, and to a vet that's maybe hasn't really been introduced to body work, hasn't gotten the bug that all of you guys have on it. Like, what do you think would be the healthiest way if a vet comes in and they're like, we're going to handle this with injections, but we're not going to look at posture, we're not going to look at feet, we're not looking at anything else, and the client has already kind of heard of these things? Like, what do you think the best way for that to happen? Like,
I mean, as a client, you're the one who tells, because you're the one who's paying the vet the bills. So if you think that's then a little bit, sorry to say so, you need to do your homework. If you know your horse has a compensatory posture, like there is so many like website out there that tell you how does a healthy posture look and what's a bad posture. So if you know your horse is standing constantly there like a goat on a rock, so then have a look. Why is it like that? If you see that your horse has low heels, long toes, then you can tell your vet, I would like to have X-rays for my farrier. Make sure you say it's podiatry X-rays, because for pathology, we take different X-rays. Your beam is going to be different, higher. It's going to be centered on the navicular and not on the pedal bone, so you can't see the angles correctly, or the shoe is sometimes overlapping and stuff like that. It's a big difference if you do X-rays for the farrier and want to look at foot balance, or if you do it to find pathology, what we usually are trained to as vets. So if you think that's a problem and then you have those X-rays, that's also then for your team then to come together. What's your sole depth? What's your angulation of your pedal bone? Because you can have a relative long toe or you can have a long toe. How is your frog? Is it atrophied? Is it prolapsed? These are all things you as an owner can see from the outside. If you can see that problem from the outside, it's definitely part of the bigger picture. You don't know if it is the sole problem or the root of your problems, but it's definitely something that needs addressing, and often correcting the feet and doing then some body work on top will remove, or some acupuncture, chiropractor, whoever is the person you believe in or is good at what they're doing, will often change the whole body already a lot. And if then there is still a sore spot 2 weeks later with a little bit of anti-inflammatories, then that's time where you do a proper lameness exam. See, is there an acute inflammation there? And then you can do a targeted treatment for that sore spot. So this is usually what I do with my clients, and it works really well. And often when you come 2 weeks later, a lot of the issues are gone. Like but it takes time. It's not, I do an injection, wait 48 hours, and then I can compete again. This is not it. But you want to heal. You do not want to suppress the symptoms. And that's when you evaluate the posture. And that's something that you can do. Go on, I don't know, there's so many courses who tell you when the posture is not right. No matter if you go and do something, look at the equine documentalist here in Europe. He's one that people know a lot. So Yogi has a lot of content that you can watch for free and see. And articles where you see the posture from Sue Dyson or whatever. There is so many articles you can see from the outside. If you have a coronary band that's more than 30 degrees, with a 98% probability, you will have an NPA inside, and that will need correcting. That's just like proven by research. We know that. So if we see that, if your coronary band is looking towards your belly button instead of your carpal joint in the front, then we have an issue there that will always cause hock issue, stifle issue, SI, gluteal pain, lumbar pain, and kissing spine. Always. If you do not correct that, you can do on top any injection, you can do the snips, whatever. If you do not correct the feet, you will not rehab that horse with a kissing spine. It's impossible.
So I agree with all of that. And you need to and you guys have those in every place.
No, like if they have
I get it.
Their thoracic sling in the front. Well, because they're compensating. Sorry when I'm exaggerating a little bit, but I see so many horses and they still function. That's my biggest problem. I often hear that, but those horses still work. Why should we change it?
Or they're winning. They're out there and they're like, I don't know. Yes. Like horses are out there competing and they're winning. So, what is there to fix?
But you have good racehorse trainer that tell me they came and they said, he was still winning, but he just won by a neck and he should have won by 2 lengths. So, yes, I mean, they're out there and they tell you and they come in and then they evaluate the issue. And often it's literally like just simple things that you can do before pathology happens, because they're first uncomfortable, they still perform, then they do have inflamed spots, they still perform, and then they break down. So it's always steps. Yeah. And it's a little bit harder for them to perform, but they still perform. And it's always warning signs if you are an owner that pays attention to your horse. They will still be good because they work till it's 12:05. And they're not like us who say, oh my God, I feel a little bit stiff. I can't do that today. Or, can we do it a little slower? No, they have such a big heart. They do everything for us, even if it breaks them.
So one of the issues that I know I have a lot of clients that run into, and this again, circling back to the lack of vets that we have, because there's a lot of vets that you guys are kind of like golden unicorns, which is why I chose you. But there are a lot of vets that don't believe in bodywork yet. They just don't. They don't necessarily think that it's a realistic thing. And those same vets are oftentimes the only vets that are in that area. And so it's not like these clients can say, cool, you don't believe in any of this stuff and you just want to inject and tell my horse to keep going, or put him in a Pessoa rig and keep lunging him for, an hour a day, or like any of this bullshit, right? That's what the vet will say. But then the client doesn't want to go against that vet, because what happens if there's an emergency? What happens if you need medication? Like, you do need to have that vet, so you can't burn that client. And so this is kind of like the section that I run into with them. There's a client recently who her horse has, he's got some pathology, but I would agree with you, it's like secondary. But the horse has really, really, really bad posture. It's a really negative angled spine. Feet need work. It's got a lot of stuff in the hind end, obviously, because the whole hind end is compensating for everything in the collapse in the front. And the vet was like, we're going to do psoas injections, and we're going to do injections into the hind end. And then when that happened, it no longer is as supportive in the hind end. So then the horse collapsed even further, right? Yeah, exactly. And so you're dealing with this back and forth, and it's hard for us, because I'm like, I can look at the posture and I can look at the feet, and I can say, hey, here are these things. It's, it's cheaper. You're not going to chase this medication. We can try to support the body back and get the body into balance. And then once the body is in a little bit more balance, like, I'm right there with you guys. Like, I'm not against injections whatsoever to help curb the pain cycle. But if you're injecting things that are supporting compensation, then you further collapse that compensation. And that's that posture versus conformation. That, like, the posture conversation to us is like a no-brainer, because we're all in it and we're all educated in it and we've seen it. But there are so many vets and so many clients that are dealing with veterinarians that don't have that conversation. And so I think that's more so the question of, like, how do I respectfully talk to my veterinarian that is my only veterinarian, so I can't lose them. I can't just say, I don't want to do this and I'm going to not listen to you. But, like, how do you respectfully say, like, this is something that maybe you're unaware of that maybe we shouldn't do. How is, I don't know.
I think they're often open to do X-rays. So if you see that your coronary band angles are really off, not how they should be, and your horse has sore hocks. So if you ask them and say, can we please do some foot X-rays to see if we can change the angles there? And there is now enough articles and supportive research there that, yes, there is a connection, and it gets more and more into all vets' heads, even though they're not really focusing on that primarily, because that's not how they work or where they work. But that's something, they can do, because like it was said from Martha, you want to help. And you want to do your best. It's not that your vet doesn't want to do it. It's just they've never done it before, so they don't know how to approach that. And sometimes you don't want to look weak. It's kind of your personality. I have no problem saying, I don't know, I need to ask somebody else. But there's other people who can't do that. And I think also...
I'm also not trying to be sexist. We are also...
The easier
men kind of have a hard time.
Sorry. But this is something, that is can be easily done, and it's a good start. Like if you really know there is a problem with thin soles and perhaps low heels, that gives you relative long toes, that will already cause compensation through all the body. It might not be the origin, it might be secondary to somebody higher up. But if you correct that part of the compensation posture, then it will give you the probability to A, build up better muscles, and B, find the underlying issue if the feet are knotted, because it takes away part of the problem and it makes it easier for the horse to function. So it's easier for you to find where the actual problem is. Just taking away the compensations by certain injections will make them break down if the base is still not good.
Right. So kind of like, just to circle back as a general whole, and then like if anybody else wants to chime in and with this, please feel free to do so, would be to, like, the things that we can do is we can say, if we think it's the feet, we can ask for hoof x-rays. And then there is so much published data out there that we can just kind of then take that and be like, here's the situation. And then also, and like, I hesitate saying like necessarily like don't listen, but like one of the things, and these are all vets, so you guys can all tell me if like this is naughty or not. But when I have a client that, like for kissing spines, and the vet prescribes a Pessoa rig and they prescribe lunging on a horse that's falling in and like isn't in balance, and they're just going around in circles with their head tied down, right? Like, we all know this is bad. But they don't want to say that they're not going to do that because that will upset the vet. And so sometimes what I say is to just not tell the vet that you're not doing it and to do pillars instead. And then when the vet comes back out, the vet's really happy with the changes in the horse. And that doesn't solve the problem with like prescribing thing. But then sometimes we can go circle back and we can be like, so actually the Pessoa rig broke, couldn't afford another one. We did this instead. And then we kind of bridge the topic that way. As a thing. Anne's nodding and laughing. What do you think about that?
Like if you get a good outcome, nobody's going to be mad at you. If it's
right.
a bad outcome,
like,
you're going to be in boo-boo.
Right. I'm like, we're just going to like meander around with this, but like, there's in no world that this is going to go well. So we just, or if your vet doesn't believe in body work, then just like have a body worker come out anyway. Like, you don't have to, the vet doesn't have to say it's your horse. Yeah.
Yeah. Yeah. And nobody says like you can't give them a massage, because that's the vets who don't believe in body work or have no experience with manual therapy. Let's just put it that way. They just think it's a wellness treatment and a good massage. That's what they usually call it. So while your horse is in rehab, there's nothing wrong about having a good massage. And if you have a good body worker, they can do the hell of a world for that horse. Nothing wrong about that.
Yep.
So I have something I want to say about this.
Do it.
Okay. So I agree. Like, if there's bad advice given and it's bad advice, like, you don't have to do it. But I think ideally you do want your team members to work together.
That's the ideal. We're talking about like the ones that just won't.
Okay. So then circling back, and so to get into vet school, I'm sure it's the same across the world, but you go into like a very competitive undergrad program where you're competing with like I interviewed against 250 applicants to vet school and they accepted 30 in my class. So the point I'm trying to make is they select hyper competitive people who are then going to go and be hyper competitive, and we all have like ego and fear, plus probably some component of like people pleasing and wanting to help. And I think when you mix all those things together, your vet probably doesn't feel super safe sometimes when they don't know the answer and they want to, like, there's this expectation that the vet is the expert. So there's a lot of pressure that has just been like systemically like shoved down your throat till you believe it. You swallow the Kool-Aid that you are the expert and you have to find the answer. And if you don't, you're a failure and you're a bad person. Like, that's I think that's kind of the narrative in the head of many vets. And so that's where you get that like very confident, my way is the only way. Like, this is what we have to do. And I think that's because the vet thinks that that's what you want. So if you come into the appointment and you say, hey, look, like, I'm really concerned about my horse. I don't care if we don't compete this summer. Like, I just really want to get to the root of this problem. Like, yes, he has sore hocks. I want to know why. You might get a vet who says, well, all horses have sore hocks, and like, and in which case, like, you kind of, that closes that loop. But I bet you some of those vets are going to be like, okay, interesting. And you could say, I would like to start with like x-rays of the feet to Martina's, or imaging of some sort. And then, or you could ask your vet, like, what are you passionate about? And that vet might say, I'm really passionate about dentistry, or I'm really passionate about body lameness, or like, give them I really like scoping things. Like, try and figure out what your vet likes to do and then use them for that.
I love that.
Again, it goes back to like the relationship piece. Like, we want clients that view us as human, and we want to view our clients as human too. And once you have a bit of that trust, like, relationship goes two ways. So it's not just the vet dictating what's going to happen, but the client is also giving back. That's where you can be like, hey, I really want to try this balance through movement method. And I'm just looking for the okay from you. This is my understanding of it. Do you think that would harm my horse? And the vet says they feel involved. They feel like they get to give an expert opinion. They say no. They might go home and search that up. They never heard of it before. Like, I think that is the way, like, through curiosity and trying to build a relationship is how you're going to get to that. And I am constantly trying to understand where my clients are coming from. And I have clients that just need to get their horse back in the pen. And eventually, I hope I don't have so many of those, because I don't like to inject 5-year-old horses. But if that's the only thing, like, they're going to ride that horse no matter what. Yeah. Then it is my job to, like, it sucks. It's like you're helping the owner and the horse, right?
It's hard.
And sometimes you're helping the owner more than the horse. But if the owner comes in and says, hey, I just really need to get to the bottom of this, and like, I don't care if we take 6 months off or 12 months off or back it up, or like, I'm willing to get my saddle rechecked. Like, as soon as I have a client that comes in with that dialogue, my approach changes 100%. And otherwise,
a lot too.
Yeah, but that's you being a young vet with an open mind. Unfortunately, some of the clients have to deal with old vets who have already their line. That's exactly how we are doing, and that's how we have been doing it since 20 years, and they're not going to change. So it highly depends on what kind of person you're working with. I've been told by older vets for rehab, like I think I was 10 years old, and I had a horse with a tendon injury, and I told the client from week 3 on, we take you 5 minutes out, we start working and walk, and
I just have to say,
yeah, you have to come closer.
I love my wife, that bad comment.
And sorry about that. And like, he was like, no, horses with tendon injuries need at least 3 months of box rest. And he looked at me, you lassie, you first finish vet school, and then you learn a little bit, and then we're going to talk again. And I was so flabbergasted, I couldn't even close my mouth. I was like,
and then you went to vet school, and you're like, no, I say
certification. Yes. And you will meet those vets. And it's like, if somebody has like Martha, an open mind, that's absolutely fine. But you know your vet. And if you know you have one of those vets who's like, it's my way or the highway, then sometimes it's easier to have a body worker on the side, because these vets usually deem body work as a massage therapy. So yeah, it doesn't hurt, but yeah, do whatever, It won't help. That's usually the attitude they have to that. Same to chiropractic or acupuncture. I don't know how many times I got told I'm doing voodoo and not through what is science-based medicine, even though there's over 20,000 publications on PubMed about acupuncture. And I'm sure like Julie has stories like that herself, or Leona. This is literally the type of vets that you unfortunately sometimes are going to meet. And it's nice if you have somebody with an open mind, then you can talk to. Otherwise, you have to come with facts and you have to ask for specific treatments and do the rest around. Ideally, we are a team and work together. The vet, the dentist, the farrier, the trainer, the owner, everything works together. I have, for my team, we have literally WhatsApp groups where everybody puts in what's going on and everybody knows what's going on. And if there's an issue, so the farrier writes in, hey, I see now he's landing on the right hind more toe than he used to do. So, and then it's like you have the bodywork going in, or I at the end go in and evaluate what are their findings. And then we as a team decide what to do. But if you can't do that, then you have to put your own team together and use the players as they are, or at least that's how it is in my world. Perhaps for others, they do it differently.
Mm-hmm. Okay. Next question. I'm going to throw this over. And I'll pick on Anne because you've been really quiet, and also because you're also a trainer and you do dressage. We have a question on, do you think that it is possible to compete in Grand Prix dressage level and not to damage the horse's body and mind?
Oof. I think that one's really hard because, what we're seeing in, like at the Olympics and so forth, that there's so much that isn't great for the horse, and I had a client. Yeah, exactly. Is it? I think I would like to say yes. That's certainly what I strive for. But whether we'll actually see it there, like at the Olympics and so forth, I'm not sure.
You have one of your clients was there, Celeste, wasn't he?
Mm-hmm. Yeah, he's getting up there.
The chestnut gelding, that one. Yeah. So it is possible.
It's possible.
Yeah.
And there's lots of, and I wouldn't necessarily say like it's perfect, but it's definitely on the thing. I think like when people ask about, I think in all disciplines that we see this, but especially like with you with dressage, and especially because you're a vet and you do BTMM and all of that. I think it's always really important, and you can speak to this too, like from a ridden standpoint and dressage standpoint, like, don't you find that correct dressage is therapeutic for the body?
Absolutely. Yeah, that's right. And that's it. It's training. That's what it's all about.
If we're training with it away.
That's it. Exactly. And if they use themselves correctly, then they're not putting strain on the rest of the body. So yes, I think it should be the basis for every sort of riding.
Mm-hmm. And we were talking about, and this is just kind of like an epidemic in all of the different countries, but I think one of the, I don't know. I mean, I think one of the most common issues is we're not developing the horses to do the job that they're doing.
Exactly. Yeah.
And so if we're asking for what we're seeing in the highest levels in all of the sports, when we're seeing in the highest levels are, and I'll pick on dressage because the question was dressage, but every dressage movement, if you actually go into the history of it, has a therapeutic benefit. The reason why it's going through levels is because if you're going through correct level, like starting out intro all the way up, if the horses are developing them and doing them correctly, they should be developing their body to set it up to do the next movement. And the movement becomes therapeutic for the next thing, and so on and so forth. And so the idea that you can go through Grand Prix dressage with a sound mind is like, that's
absolutely
should be showcasing the most healthy body. And instead, I think that people are getting so focused on the movement, almost like they're training a trick.
Yeah.
The therapeutic benefit.
Absolutely. Absolutely. And the fancy movement, do the legs fling out enough?
Yeah.
Is the back end coming as well? No.
That is, there is another question that was kind of along those lines around like the breeding. I'm going to try and find it. Oh, how body balance. I love this question. How does body balance affect the horse's mind and vice versa? And are we seeing more imbalance in the bodies horses bred for top sport because of that?
Yeah. And because they're a little bit hypermobile,
Mm-hmm.
you know. So I think, you know, our breeding, I think we probably need to go back to the more classic horses because they are probably more stable in their body.
Yes.
And therefore easier to keep strong.
Mm-hmm. And
I think
for those that don't know, when we're talking about hypermobility, we're really like, not to be dramatic, but we're technically talking about the fact that we've like bred out connective tissue.
Yeah, exactly.
Right.
Exactly.
And so like for those like the, you know, and we've got like Martina's got a video that we'll throw in at the end, like after this recording's done, when we edit it before we upload the recording, we can stitch in a couple of things. And one of them I might throw this into is like the missing lamellar attachments in the neck.
Yep.
You know, we used to have quality support that came down and attached at the cervical spine to help suspend the cervical spine. And so perhaps maybe 100 to 200 years ago, doing hardcore thoracic sling stuff it didn't have to be as big of a deal.
Needed.
The cervical spine was supported. And now it's gone. It's not even lack. It's completely absent. And then that trickles down through. We have these horses that can do these big flashy movements that before, you know, certain muscles allow us to do different things. And now we have horses that don't have any development that can do flashy moments. And so then they're more.
And they're the ones that need this work more than anything. Yeah. Because they need the muscles to help support it because they don't have the connective tissue.
Mm-hmm. Yeah. And I would say, you know, in terms of like how it affects the horse's mind and vice versa. And I've seen this with every single one of you when you've worked on a horse, like when you get a horse, no matter what modality you're using, when a horse finds balance in their body again, their mind calms down.
Yeah.
It's like the nervous system, the mind and the body cannot be.
Yeah. That's it. So my mare that I came to you for, we've had x-rays done and she's ECVM. Mm-hmm. Because I, you know, work so much on improving their body, she didn't show obvious neurological deficits or anything, but she's got that flashy movement. Mm-hmm. And because we worked on improving her body, she coped. But in moments where she was heightened, her body stopped functioning.
Right.
You know, and I would have said that she was the most even horse I'd sat on from right to left, but she's only unilateral. Mm-hmm. So I think we can do a lot to improve them, but if that underlying structure or, you know, connective tissue isn't there, there's, you know, in those moments where their body isn't functioning in that heightened moment, you know, that's where things fall apart.
Yeah. There was actually an ECVM question. Let's see if I can find it. In cases where something is troubling the horse, body dysfunction like ECVM or abnormal development, can BTMM always be practiced, and how can we co-navigate that with our vet? I would say, just from like my own standpoint, ECVM is quite a spectrum. And we have horses that have ECVM that you wouldn't ever know, that like we found out on accident, you know, it just came up on an x-ray and we were like, no way, like the horses never had any issues. And then we've had other horses that from the time they were a baby, they were not okay. And they were never okay. And maybe we've maintained their okayness. You know, we've got some that we did BTMM from the very beginning when we started them. And so they developed really well, but like they just weren't developing the same way. Yeah, like there's something not right. Or if they weren't incorrect, they would start to fall apart. And so like you would see that. So those horses, you know, or like horses like your mare that like maybe they felt fine unless they were like heavily in the sympathetic. And then all of a sudden they're not.
Yeah, that's it. And then can't function.
can function. Yeah. And so I think, the one thing that I really try to tell people, especially because there are people that are like, if your horse has ECVM, it doesn't matter. It's totally fine. It's been around forever. And then there's people that are like, if your horse has ECVM, you must shoot them and never ride them. And I'm like, neither are true.
Yeah. Yeah, that's it. It definitely is a spectrum. And, ECVM doesn't mean that everything has, a process that's moved. For my mare, she's only C6 malformation. So she doesn't have that muscle attachment underneath the neck for the longest coli. So it doesn't matter what I do, that connection isn't there. Whereas if it's C6 and C7, at least they've got that muscle connection onto C7 so that they've got some support. It's not normal.
Right.
But at least they've got it. It could be unilateral, it could be bilateral. And I think all of those things are the reason why we can't just say, oh, it's got ECVM, so it's, it need to be killed, or it's got ECVM, it'll be fine.
Right. Yeah.
Yeah.
And in terms of like the question was like, can BTM always be practiced? I think, and that's kind of like, there's a various like things in there where they're asking, just because I'm on here on BTM, and it's like, it's not any different than any other training thing or rehab thing. It's like, if the horse is going well and they're receptive and things seem to be going well, use it. If you're using it and the horse is not receptive or things are going downhill, don't use it.
Stop.
Yeah. It's just a very, like, there's not ever, I always hold, I talk about, like, I always hold two truths at the same time. Like, half of me just assumes that there's something catastrophically messed up in that horse that I can never, ever, ever, ever fix. And that keeps me really, really, really careful. And then the other 50% of me is like, no matter what's going on in the horse, the body wants to heal if we can support it. And so I kind of play.
And sometimes, exactly. And sometimes they have to get worse before they can get better.
That's true. A little bit. Yeah.
So
sometimes they don't face some of those things as they kind of like come apart. And so I think whenever we're talking about, is it okay to do BTMM? Is it okay to do these things? It's like the most important thing that I can stress is to anything that you're doing, number one, like I would suggest working really closely with a person and making sure that you're doing it correctly, because there's always a correct way and an incorrect way of doing something. And then also really knowing your horse and being like, is it doing well in every session? Like, I know like with us with the pillars and stuff, like in every session, you should see some improvement. And if there's not an improvement, or if the horse is getting worse during or after that, like, don't do it again, like by no stretch. And so I think that's the biggest one. There's Leona. This will be a good question for you. For a horse that has arthritic changes, is BTMM recommended in addition to injections?
I guess they mean arthritic changes in the joints like hocks or stifle.
Yeah, what would you say as a trainer? She's one of my trainers, just so everybody knows.
Well, I would just a little bit like you said on the ECVM, it really depends on the answer of the horse and how it can move. I mean, usually, even in traditional rehab, we move the horse in the gait that it's not lame in. So often when they have some arthritic changes, they're already good enough in walk. And and sometimes the compensatory posture they put themselves in is now the bigger problem that the original arthritic changes maybe ever were. So when you can help them with their posture and the way they feel in their body, that they feel good, and maybe their psoas isn't hurting them so much anymore, or they can find a more balanced way to stand, or they start laying down at night again, things like that. When you can help them, often the problem in the joint can, get better, or at least not get worse when you do it mindful. I think the mindful approach is always, and going with a horse, and I think especially in BTMM, we really always look for the feedback of the horse and the nervous state they're in. And when they work with you and they want to do the movements and you go slow and watch the horse, I don't think there's any problem with that. If they have an acute inflammation and it really hurts them to step under themselves, and you correct them again and again, and because you really want that posture that they're not able to be in, then there can be a problem. But I think if you go with a horse, I would not see a problem in doing that.
Yeah. Dr. Page, I think this is because I know this is all over the board, but what would you think like the biggest symptoms of skeletal dysfunction are?
Again, poor performance. I think a lot of people, that's what they recognize is that, something's changed. My times are off. My movements are off. There's usually some performance thing that owners or even veterinarians are told of first before recognizing that, again, we now see so much pain, before they even get there, by facial recognition of, the pain scores, things like that. But I think performance is generally the things that most people, owners, trainers will go off of before, other things can be recognized sooner. And that's where preventative treatment, to me is, just so important before they even get there, to that poor performance state.
And for preventative, would you say that like having more like routine chiro body work, having like routine vet exams, just coming out and just making sure that things feel good?
Absolutely. I've always been a huge proponent of, I tell my clients pre-season vet checks. If you have a certain season that is starting, for me, working in Vegas and in Washington, it's kind of off seasons. They shut down here in Vegas during the heat of the summer, and then they pick up in the fall. And then in Washington, it's different. It becomes rainy, cold, muddy season, and they shut down. So there's, having that preseason, a month or, 6 weeks at least prior to your season really getting kicked off. Have your vets come in, have your body workers come in, look at these horses before you're, into your season, and now you have a problem. Because that preventative, sessions can definitely make a difference. And that's what I, try to push as a veterinarian, and a body worker. We need to work together and get these, preseason vet checks. It's like a preseason trip for your car. You're not going to go running across country without, having your tires checked, your oil changed, things like that. So get it done now before it becomes an issue and you're missing, your futurities, your buy-ins, your, a certain amount of barrel races or whatever you have to hit. Find out before it's too late. And then, trying to catch up and treat this, inject that just to get through that rest of that season.
I love that. Yeah. And it's true, man. Like, I don't think there's very many that necessarily do that. It's just like, you just kind of go hard and fast. And then we call you guys when there's a problem versus.
Yeah.
That's where deaths of the farriers, like, because if you are a farrier or a trimmer, you see the horses every 6 weeks.
6 weeks, yeah.
4 weeks. And they see when little things are changing and they see them regularly. And that's so helpful. That's something that's often overlooked for body work.
We have one specific question. Leading with, she said, assurance, I do work closely with my vets at the diagnosis to treat my horse. So I'm not relying on this discussion as veterinarian advice, but rather curious if anyone may have something to discuss on the subject. She said, I have a horse with an old tibial crest fracture, and I'm curious to hear any discussions from you guys on the long-term impact of fractures that affect the joint surface, as well as any case studies or stories that might be relevant. Any takers? Who wants to go first? I'll just let you guys go. What you got, Miss Page?
Again, I think there's a lot of, getting old things that the body compensates for, the compensatory patterns of, something like that, and the structures that attach to, the tibial crest plus, the joint, things like that. I recently said, even with the advent of, acupuncture, I didn't and whether I slept through these parts of, veterinary medicine schools, that I swear I didn't learn horses had hips. I think there's, with acupuncture, I've found more horses that have actual hip soreness than ever before. And the compensatory for, again, stifles, like we've always learned, the joints above and below are usually affected from something that's been, injured there. So I say, you got to look at other structures. It could, do we just focus on that because it was the primary see was the tibial crest fracture? But what else has been affected because of that? Has that, because it's old, kind of stabilized, but the compensatory things of, again, above and below, hocks and hips to me, and, I always say we always learn to treat the holy trinity of coffins, stifles, hocks, SI. And there's a whole joint in between all of that we've missed. And again, just the beauty of diagnostic acupuncture has just amazed myself and other practitioners. Like, did you know horses have hips? And that they can be treated, and treated very easily, with the right, medication, because boy, they're sore just like us. Hips get sore, and we take care, and then pretty soon your knees are sore, and it just works its way, and your back is sore. It just works its way. So I think focusing on that, you have to look again around it versus just the tibial crest fracture too.
Yeah, and and also, and I know you've said this before too, but like if it's always looking on the opposite limb, and then also the diagonal limb.
Diagonal.
Yeah, because it's just like if that's going on and there's an injury, they're going to automatically load more into the other one, and then they're automatically going to load more into that diagonal one. And so then that's where you're going to have your compensatory thing. And they lose, right, when they're initially going through the injury. So it's not like that compensation is bad necessarily, but it's something that you want to just stay on top of. So like that's a big thing that we look at in injuries, is like just being aware where the body's going to take a bullet for this injury, and then trying to go back as this injury heals, and maybe they don't need that compensation anymore. Can we come in and can we release that compensation so that the body can go back to as much structural support as possible?
Absolutely.
Can you talk a little bit about the acupuncture and the like how you diagnose and do stuff with that?
Well, and again, it's just, and it sounds like these guys, some of these other panelists have, done it longer than I have, but to be able to, do the acupuncture scan of an equine, that they know their bodies so well that we can scan them and localize points that are suggestive of, stagnation or pain, it has just really rocked my world. And again, flexion tests, if you flex a hind limb, you're flexing a lot of other things rather than, just a specific joint. And that's why and feet. Again, Martina, and the feet with diagnostic acupuncture, I have found more feet soreness that might not test to a hoof tester. The horses aren't lame. They're bilaterally sore, so they're not lame. But boy, they show up as an acupuncture point, and you put in a needle that's diagnostic for a foot soreness, and all of a sudden that acupuncture point goes away. Again, you can't unsee this as an owner or a practitioner.
Yeah, I will tell you, it's full witchcraft. I watch it and I'm fully into all this stuff, and I see it, I'm do that again. What?
Yeah. And that's where, again, and even taking, very good lameness practitioners and showing them that, look besides, just because the horse doesn't flex, lame to that joint, or again, negative to a hoof tester, doesn't mean that they're not footsore. There's stagnation or pain there. And, to look past that acupuncture has literally, I just throw my hands up and shake my head, and they're like, how does that work? And I'm like, I don't know. It's just been around for thousands of years. And these guys have literally perfected this.
Yeah.
And it just literally makes me giggle that I can do something to show that horses, and they know their bodies so well and respond to one needle.
Yeah.
One needle can change a life.
Yeah.
So I just, again, been around for 36 years doing this and can just change a life with one needle. And when it was proven to me with that, I literally said to, the TA at, the acupuncture school, I've been doing this wrong for 36 fucking years. And she said, no. You now have another tool in your toolbox because, you look outside that box. And it literally has changed my life.
Mm-hmm. And having the combination of both. Like I remember, we were talking about a couple different horses and you're like, hey, we do the acupuncture, we've done the chiropractic. So on my lens, what I think is really cool about that is like, so for the pillars, like how we do the in-hand work, especially, like it's meant to be a slow roll of going with the horse to kind of like slowly release things so that they can naturally go in and open the joints, and then so they can naturally go in and develop the body, and then kind of over time things kind of calm down. It's a hell of a cheat system for me to be able to take my horse to you and be like, if you can adjust the horse and do the acupuncture, then they get access to the body so much faster, right? So like, and not everybody has access to that. And so like, BTMM is great for that. But if you can get this done and you can kind of free up all of that stuff first, it just gives them such quick access. But then circling back to the veterinarian medicine standpoint is that like, okay, so everything's feeling good. They have the open channels. The joints are more in alignment. They have access to their body, so we can start developing. But then maybe this thing with the TMJ comes back. Maybe, this thing here. And then circling back to that veterinary medicine, we can go in and we can do an injection. We can do medication and we can kind of solve that. And so understanding that it's, it's not like a this versus that, it's just a both. And like everything should be complementary of one another.
Absolutely. Yeah. And that's where, that's how I kind of use it, is that, my goal is to let body heal thyself, in there. And if that doesn't work within, 2 to 3 treatments, then we have to look at something to help the body to heal and allow that muscle memory or that high fight or flight with the tension in a TMJ, the amount of sensory input into that. Some are just like people, they just hold everything there. But, sometimes I just have to go in, again, have them injected, clear that out. And boy, it'll change the life of that horse, the rider, the trainer instantaneously, and have seen it time and time again. Mm-hmm. But yeah, acupuncture again, and even, we're not taught that in veterinary medicine. Again, whether I slept through these kinds of, TMJs weren't ever a thing, but boy, when it's shown to you that these horses, and again, shown several practitioners, touch here, feel here, you can see the reactions, or, oh, you can't bridle them. Owners want to say this, or trainers say these things. Listen to that. Those are reasons why these horses don't want to play. Reluctance and resistance is a reason. And those, little things are huge in their world. Mm-hmm. So, and that's where, to me, injections, working as a complementary, you got to use it both in my world.
So maybe, from like a preventative standpoint, or even from like a treatment standpoint, would you guys, and I know it varies kind of case to case, but like if you were to go out and to look at a horse, perhaps, first kind of like addressing like the overall like posture of the horse and being like, what's going on from a postural standpoint, and obviously with the feet, because that's all you can.
Oh, absolutely.
Connect those two. So like, okay, we've got posture, we've got feet, kind of setting that over into a box of like, these are things that can be worked out in this way. And then you go in and maybe you do chiropractic acupuncture first and kind of see what that doesn't clear up and allow for that. And if that helps, then maybe giving out, let's talk about training or posture to like kind of help carry this forward. But then if that falls apart, then you would go into more of a diagnostics for injections and other things. Would you say that's kind of like the general flow?
Yes. Yeah. Because as you've, again, in all your methods have said, body wants to heal. The body wants to heal itself. And if we can avoid, as much, medications and joint injections, things like that as we can, because we start the degradation cycles. And I think it's great. But sometimes, we have to, the inflammatory process is just so, huge. And, there are structural things of, spurs or things in joints that we do have to quiet down. And then hopefully the body will, again, address the issues with, the body workers, the acupuncture, the chiro, the structural, the feet, And boy, it can be just a thing of beauty when it all comes back together and people are just wowed that, again, my times are coming back, my performance is coming back, and can see that.
Love that. Another question in here is, what do they think of sciatica? Is it real? And horses.
Yeah. But that's where the acupuncture scan is so helpful, because sciatica shows up like a red exclamation mark, like when you just scan them, like literally they jump to the roof if you do it correctly. And then you can, like Dr. Judy said, you can then just use 1 or 2 needles to see if I put them in that point, is that pain going away? If the pain's going away, this is a diagnostic point. So I know, because I've seen there was a question, what's the difference between treatment acupuncture or normal acupuncture and diagnostic acupuncture? I can use certain points when I know how and why to see, do I have an ulcer problem? Is it beat stomach or large intestines? If I have a reaction to certain parts I'm touching, and I put 1 needle, let's say in stomach 36 and stomach 37, and I do not have sensitivity anymore on parts where they're usually sensitive to touch when I have ulcers, and it's gone just from 1 needle, that will tell me, okay, with a 80%, because I did research on that, with an 80% probability, I do deal with ulcers. Or if I have like the foot pain, if I put Tiantimen in and it's no longer sensitive on top, I know there's a foot issue. That's one of the videos I sent you to share. So you can see it's not a primary problem up top, but the sensitivity is gone in the neck, in the shoulder, in the back, even the hind end. Because that's where
I watched this firsthand with Julie, and I was like, "Oh my God,
it's so easy!" And this is something that get taught. I had the pleasure to do that at the IVAS conference 2 years ago for vets, and also in the wet lab, so they can learn and they can see it. And once you've seen it, you can't unknow it, and it's so easy. And these are why we have diagnostic points, and then we can check, do we have problems? Or if I palpate from chiropractic, I feel I have a viscerosomatic reflex on certain areas where I have a hot spot or a soft spot in the back, I can then check with my acupuncture scan, is my liver showing up? If my spleen showing up, then you can treat them with herbs or anything. If I have a lot of little pathology showing up along the spine or everywhere in the arthritis problems, I have nothing against cartrophin. That's one of the things I use regularly, and it's so wonderful because it's a regenerative therapy. I can give it somewhere in the neck. It's not directly into the muscle, and the body can help itself to heal. And it's little things that everywhere in the body, it's often like we've been talking about those compensation products. Yes, it might have had a tibial fracture, but it has overload, then the contralateral coxofemoral joint, and on the other side, the lower cervicals, and here a little bit in the spine where we have like the torque, like where we have the compensations going through. And these are all hurting a tiny little bit. So if we then just concentrate on the stifle where we had the original problem, we're not getting the whole pictures and we're not treating the whole body. So I'd rather have something that I can give systemic and it does the work for me. And it doesn't always have to be acupuncture. I have no problem when the vet says, oh, we see there's lots of little things. Let's try some cartrophin. Pentosan, like I think in the States it's called differently. But that's it's a regenerative therapy that helps the body to heal itself on little different spots. And we can do so much. And it's every time you learn a new modality, no matter if it's myofascial or if it's acupuncture or whatever, or chiropractic, it opens worlds to you. You learn more about neurology. You learn more about fascia. And for me, my acupuncture works. The answer is fascia, because acupuncture meridians follow myofascial kinetic lines. If we put an acupuncture needle in, we can see how the fascia is holding itself on the needle, and it turns around. It's special points where we have like more oxygen in the blood. We have like special nerve centers there. We have like special blood supplies in those acupuncture points, and everything is connected with fascia. Fascia creates plyoelectricity. That means the moment there is tension on fascia, it changes its properties. So it gets either more fluid or it gets more hard. So depending on what we're doing when we put an acupuncture needle in there, we're changing immediately in microseconds how the whole system is working in the body, how fluent it is, how the hyaluronic acid is flowing between everything. So it's just structural medicine. It's biotensegrity, because it's not just what we put in and how the system is changing. The whole hormonal output changes. And that's something we can measure in the blood. And that's why I don't understand why it's supposed to be hocus pocus, because you can actually measure changes in the body.
Okay. Because thousands of years ago, when this was created and known, since then, there has been, which my little native self likes to call colonization, where people come in and they think that they know better, and then they shut down ancient medicine that was actually proven for years and years. And then thousands of years later, we're like, oh, have you heard about this thing that we're just figuring out? And it's just fascinating to watch the whole. It's like, okay. No, I love it. It's just, and every time I get to play in with it a little bit, it like fills in pieces for me. Cause like my lens started with just nerves, and then it got into the development of the body. And then now I'm playing around with like the myofascial, and it's all the same. It's not all the same thing, but it is all the same thing, because it's all connected in the same ways. And so the more I learn more language, and then it's just different language to help with different. Yeah, it's just the coolest
You
thing.
can't work on one system without influencing the others. And that's where I get sometimes a little bit upset when they say, oh, myofascial is everything. And if you have a scar, the whole system is not working anymore. No. The system has different tension, but it's still working as a system. It has just...
Horse is still competing on meter 40. So like, I don't know what to tell you.
So, and yes, if you have gelding scars, it will affect how they're moving, depending on how big they are and how elastic, or if we have adhesions higher up, or if we have a cirrhotic cord that's encapsulated in it. I had horses who couldn't canter anymore after they got castrated, and they had before a beautiful ruby canter, and then 3 weeks after castration there was like just bunny hop or trot, or even refuse to canter on one side. That's something where you really, really have to look into it. But usually manual therapy can help enormously. You also feel those scars are so cold because your blood flow is so reduced. And you can help that. Manual therapy is absolutely brilliant to help with those cases. And yes, it will affect their movement if they're still there. If it's really bad, have your vet put an ultrasound on, see how deep is the scarring. Do you have adhesion with your inguinal ring? If you do have sore, is there a cirrhotic cord left? I had cases like that where we had to put them back under surgery, cut that piece out because it was constantly festering inside. It's an encapsulated infection. So the body doesn't have your SAA is not higher because it's encapsulated, what's quite rare in horses because usually it's always generalized. But in those cases, it's just there and it's sitting there and it's like holding on. But if you remove that, then the body can actually heal. As long as there's still something poking constantly, it can't heal.
Does any of you guys use KT tape? Is that a thing?
Yeah, I use it a lot. It's about 15 years. It's again, neurological input. It's proprioceptive input. That's actually what it is. So you work again, very similar to either light touch or to manual therapy. It's just a constant input. You need it to be on there for at least 30 minutes because that's how it changes your neurological input then into your central nervous system. But it works quite well. I even recommend it a lot for my competition horses for long travel. To stabilize them just on the back. I really, really love it for long travel. So they're not tired when they come back on and not that tight, especially anything longer than 3 hours. I recommend to take.
That's badass. I had not heard that before. That's really cool. I will definitely add that to my repertoire. We're gonna I could talk to you guys all day. We're going on for 2 hours though, so we're gonna try to close out a little bit quickly. Randy, you circled back and you said that the arthritic changes for BTMM, for a horse that has arthritic changes is BTMM recommended in addition to injections, and that was specific to cervical spine. We do that for the next, my thought on it, and I'll, you guys too, is like, so what BTMM does, like for pillar one, like what we're trying to do with the neck is we're slowly seeing like how much tension needs to be in the neck, because there's not supposed to be that much tension in the neck. Like if the body is stable, the neck should kind of be able to move freely. And then if the body's unstable, then the horse goes into tension in the neck. And so you kind of see that pair go back and forth. And so if there's arthritic changes in the neck, it's the same thing that we kind of mentioned with all things with BTMM. And there's another one around like, is there any contraindications for that? And like for me, your contraindications or being careful around when or where to use it is if the horse needs it. If the horses are sore on their feet, I won't do my work on it, because everything that BTMM is saying is to help put the horse back in their body and load it and press into the ground. So we want that support. And so if the horse has sore feet, or if they have some kind of an injury, if there is heat and swelling, if there's something that the horse is having a hard time physically pressing into the ground and supporting in their four corners, then I won't do pillars on them, because that's not fair, right? Like they don't want to load into that. So I'm really mindful about that. And for the cervical stuff, like I tend to find that a lot of the pain that the horses are having in the neck is because of too much tension. And so we'll offer them pillar one. And if it starts to feel better.
Yeah. 3 is probably, do 4.
Accidentally muted. If the horse is starting to show relaxation signals and things are feeling better and you're seeing that tension calm down and things are going better, then we keep going. If you're doing it and the horse is popping its head back up and it doesn't want to go into that posture because it's painful, don't do it, right? Like it's just you just want to follow what the horse is saying and going off of that. Oftentimes, oh, you're fine, Lindsay. It happens all the time. So just always going with the horse, but trying our best to know. And one of the things that I love the most about pillar one is if the horse feels safe to be touched and the horse understands halter signals, then and like this is from a diagnostic perspective, and this is not only for my work, but for veterinarian medicine. If the horse has those two things, then when we go to ask the horse to do a maneuver, whether they're doing a flexion or I'm asking for pillar one, if the horse is popping out of that and not wanting to go into it, and I know that the horse feels safe to be touched and they understand the ask, that tells me very clearly that it's uncomfortable, and then we don't do it. It's just, black and white. Where you get kind of misinformation on that is if the horse doesn't understand what you're asking and they're popping out of it, it might just be because they don't feel safe, they don't like the gear, or they don't understand. So clear that up first, and then you can follow the horse a little bit easier. And then the last question that we had on here for not diagnostic-y stuff, but for exercises is, what are the best exercises for iliopsoas injuries? And if the horse exhibits long-term iliopsoas issues like toe ticking, is BTMM the best exercise? From my standpoint, and I'll throw this over to whoever wants to chat with this, I wouldn't necessarily call it an injury with what I deal with, but what I deal with is when the horse has a significantly negative angled spine, and the horse has a dropped thoracic sling, they're automatically holding way too much tension in the psoas. The psoas is overactive, so it's no longer able to just move and support the way that it's supposed to do. And so the horse will be sore in the back, or the horse will demonstrate the toe ticking, the horse will demonstrate some of those symptoms. But I don't go straight to targeting the psoas because it's secondary to me. The psoas is being overworked. And that's where, like previously I was talking about a client where like the vet went in to inject that to try to like nerve block it and calm it down, and the horse collapsed more. For me, I want to know why that's under so much tension. And I want to try to build up the sling to neutralize the spine so that the psoas can go back to functioning the way it's supposed to function instead of in so much tension. So, but that's not really an injury. That's dysfunction. So iliopsoas dysfunction in that way. And so in that way, I think that pillars work really well for it because it's not a direct injury. Injuries, I'm sure it requires some kind of rest and other things. Do you guys have any throwdowns on psoas stuff?
I mean, there's some really nice points from Kerry Ridgway, where you can actually test for the psoas specifically. If you put the needles in.
Yeah, okay.
it's kind of like you put an acupuncture point needle in, but it's not on an acupuncture point. It's one of Carol Ridgway had very specific points that he had. They were not on meridians or classical points. But this one is because he had them specifically for muscles. You can also, if you have certain points, you can specifically address certain muscles with those points. Because over the myofascial connection. And there is one for the psoas. And his take is, and it was really nice to see if you ultrasound them afterwards, rectally, you can actually see, because you have to look for the injury and then you can find them usually. If you put the needle in and the reaction is gone that you have on top from the psoas, that's overworked. If the psoas is just like contracted and you take the needle out, it's gone. It's fully clear. If you take the needle out and it's a true psoas injury, it will come back. And that's why we say, please take a rectal ultrasound and check it. And often you find either SI ligaments on the inside that are injured, or you find the attachment of the psoas or the origin of the psoas that has a problem. You can actually see that on the ultrasound, but you have to know, you have to look for it. Otherwise, you're not going there. You would never do that without having a true, indication to do that, because that's usually not what you're doing. And I'd say 90% of the cases, it's what you have seen, that it's a poor thoracic sling that's decompensating the back and causing a sore inflammation in the back. I've only seen true psoas injuries with slip injuries on ice or very muddy ground where they did the splits or like this. And then I've seen, or when they got caught in hay nets and pulled like crazy. That's another one. Otherwise, I haven't seen true psoas injuries.
Cool.
But
yeah. Awesome. And then I lied, there is one last one on ulcer prevention. And I'm just going to kind of circle back to what you had talked about in the beginning around like how with the ulcer prevention, there are so many components to it, but environment, feed, stress levels, right? So you want to those are your top three. And then I would agree with you that I see a lot of reoccurring with, and again, I call it more thoracic sling failure, but when you have sore feet that's collapsing in the front and everything's pulled forward, you've got so much tension going on with that even if you have a perfect environment, even if the horses are on 24/7 feed, even if, all of these things, if that's not addressed, you're always dealing with that. So you always kind of want to support that body, get your sling up, neutralize your spine, support all of that. And then another kind of a last throwdown that I have noticed, and this is just, I don't know why, and this is just kind of a thing overall, but the number one go-to for ulcer treatment on stuff is ulcer guard. And what I have found with that somehow, I had a vet years ago that was like, we should treat the horse for hindgut. And I'd never heard of hindgut ulcers. And so he put the horse on sucralfate. And this was a horse that had been dealing with just repetitive ulcers, right? Coming in, the sling was, other things were going on, but it was he had been fed, he was a higher level competition horse and he'd been fed so much ulcer guard that I feel it just he was, the way that the vet explained it is he's it basically just messes up the pH in the gut and it's just signaling back, and ulcer guard doesn't treat anything for hindgut. And if there's hindgut ulcers, it's going to get moved to the front. He's I can't scope for hindgut, so I can't tell you, but symptomatically, I think if we put the horse on sucralfate, we'll see how it does. Everybody's nodding. This is okay. Because it tends up being a really unpopular opinion, because I have this all the time with the horses with the reoccurring ulcers. I'm like, what are you guys treating them with? They say ulcer guard. I'm like, have you ever treated them with sucralfate? And they're like, no, we've never heard of it. And the vet's like, we don't do that. This is for this. But then when they do, the symptoms go away. So is that a thing that you guys have found with the hindgut as well?
Yes, and the other thing is when you treat them with omeprazole or something similar, 30% of the horses do a rebound. So the moment you take them off the medication,
omeprazole,
the moment you take them off the medication, they make an enormous spike of acid production, and that's 30%. So taking them off the medication is causing the ulcers, because they surge the acid. That's about 30% of the horses. So you can't just take them off the medication and because they were good. That means they have to have the sucralfate, or I like some other things like slippery elm or marshmallow root or something like that. We have here in Europe, we use TRM, the GNF, where we have everything in. You have also your amino acids, because threonine and methionine are your amino acids who heal your gut mucosa. And then you have often there's like some magnesium or calcium oxalate in there to balance the acid, because when they make the surge, your acid gets more strong. So if you use something like how do you call them? Thumes, is it America? So it's reducing your acid, and that's you need something like that when you take them off the omeprazole, because every third horse will get ulcers because you take them off the omeprazole.
Yeah,
and that's often underestimated.
Oh, hugely. Like vets over here, I know, like they don't, I feel like I was very lucky. He was kind of like an old cowboy vet that had been there, done that, and he just like knew things, which are my favorite. But mostly in like the high performance ones, those horses are just having repetitive ulcers and they are just on omeprazole, and then they take them off and then they get symptoms and they're like, well, we treated the ulcers, so it's not ulcers. And I'm like, it causes so many issues.
I feel that, ulcers are a symptom of something else.
Mm-hmm.
They're not, very few ulcers are primary. To me, again, they're fretting about something, my body's in pain. And I think that's you got to find the primary. And again, then heal the ulcers and hindgut ulcers, and everything seems to get better. But if you don't find the primary problem, it is a vicious cycle of these horses. And, to me, what's the source of pain or what's the source of worry? I've had barns just change personnel, and that dynamic in itself has caused multiple horses to have ulcers, or if somebody, has a traumatic thing in their life and they just bring that to the barn. I mean, again, you got to find the source of the pain, and the ulcers, I think again are a symptom of something else and not, the primary problem in my, thought process.
I wholeheartedly agree. In terms of ingredients, just to throw this out there, years ago, a dear friend of mine was like, there's an ulcer tea that we make, shout out to Stephanie, and it is raw aloe vera juice. And then we mix 1 cup of the raw aloe vera juice with, we'll sip a tea of marshmallow root and slippery elm. And we'll do 1 cup of that with 1 cup of the raw aloe vera juice. And we just mix that over the Timothy pellets. And a lot of times I just kind of give that to my horses in general, like on times of stress when we're hauling, in the winter time, like if we have like weird, like temperature fluctuations, we'll throw that. And it's just a really natural thing. And even when I treat with sucralfate, if I have a horse that I come in and I'll treat it with sucralfate, oftentimes I'll put him on that ulcer tea as well. It's cheap. It's easy. You can keep him in gallon tubs in the barn. And that's just kind of like a nice, gentle, holistic thing that we can do. But I won't take you guys any more of your time. You guys are so generous. I'm so grateful. I know everybody is just like, oh my God, it's so nice to have vets that are so passionate about all of these things. And hopefully, people walk away with a little bit more validation, I think is a big thing, is just to hear that there are thought leaders like you guys that are all over in different countries with different walks of life, where you guys are seeing these problems and handling it that way. And I just really, really appreciate you guys. Thank you, everybody that came on and all of the questions. When this, it's long, so it's going to take it a little while to upload, but when it gets all done and uploaded, we're going to do it. I've got a really excellent video that Martina's talking about with like how to scan if it's hoof pain or not, which I think will be really helpful for people. And we'll stitch that in at the end. And that's part of like the cool acupuncture stuff that her and Julie were talking about. I'll slap a couple of slides up about talking about like the connective tissue that Ann and I were talking about, so you guys can kind of see what we're talking about with that. And I might also do like a little write-up of just like answering the questions that came in, just so people, if they don't want to listen through the 2 hour, they can at least have their questions answered. So I'll put that in too. And yeah, thank you guys. This was really awesome. You're amazing, all of you. Thank you, thank you, thank you.
Thank you. And again, if it wasn't for you, this wouldn't be getting out there. So thank you, darling. Very, very
I'm just going to keep collecting my infinity stones and throwing this infinity. But all right.
Happy to help.
Thank you. I love you guys. We'll see you all soon.
Thank you. Bye.
Bye.
sore. I know. I'm sore right here. So if I take attention out here. See, it's no longer sore.
So what did you put on?